Good morning. My name is Kaylee Claver. I am the Nurse Residency Coordinator in the Nursing Education Department here at MercyOne. Today, I'm going to talk a little bit about the Nurse Residency Program, the expectations of it, and what to expect when you're in our program with us. So I'm going to share my screen and go through a quick PowerPoint with you all. Okay, so this is me and my information here for my contact. So if you ever need to reach out to me, please send me an email. I don't have an office phone listed there, so you can always send me a text and I will respond. But I do prefer email contact. Okay, so today we're just going to discuss the why of the residency program, what we expect from you when you're enrolled in our program, and then some benefits of being enrolled in our program. A little bit about my background. I won't bore you with this, but I have been a nurse for about 10 years, have some med-surg, tele, ICU, and cath lab experience. And then I completed my master's in nursing education and have been with the nursing education team for just a little over a year. This is our med-surg educators. So Gina has 5 North, 8 North, 8 South. Nikki has 7 South, 9 South, SSU, Cath Lab, and Cath Lab Recovery. Amanda has 5 South, 6 North, 7 North, and then the acute care float pool. Jen is the educator for med-surg and ICU out west. Some critical care educators that you might see, as well as emergency department. Amber with neurotrauma, critical care resource pool PCU. And then Amanda is over CSICU, cardiac device specialist and ECMO specialist, PCU, and then most recently CMICU. And then Jen, like I mentioned, is over ICU out west. Angeli is our educator in the emergency department downtown and at west. Our maternal child service educators include Kendra. She's over mother-baby postpartum. Amy has labor and delivery, OB/ED, and antepartum. And then Amanda has NICU, PEDS, and PICU. We do have several other team members involved in our education department, but these are the educators that are involved in the nurse residency program, and you will see them teaching your sessions. So a little bit about nurse residency. It is a 1-year program. So you will start whatever cohort you're in and meet for 11 sessions. Your 12th session or that 12th month is graduation. So like I just said, 12 monthly sessions. The 12 months go from, or the 11 months go from 8 a.m. to 12 p.m. And then that 12th month of graduation, the time will be announced closer to the graduation date. So whoever has 6 months or less of experience as a nurse, or maybe hasn't been in an acute care hospital setting, ICU, specialty service line, like the mother, baby, labor and delivery, all of those types of, where if you fall into that caveat of less than 6 months of experience or lack of experience in a specialty area, you will qualify to be enrolled in our residency program. And then anybody who is full-time or part-time also automatically gets enrolled into our program. Our program isn't a program where you apply to be part of it. It is a program that you're automatically enrolled if you meet these qualifications. And that is just because we believe at MercyOne, we want to help that support for all new hires, new nurse hires. There's lots of evidence out there that shows support for a nurse in their first year of their profession helps them grow exponentially over that year. And we'll talk a little bit about that in a second. So there are 3 cohorts: spring cohort, summer cohort, and fall cohort. Depending on when you were hired, when you complete orientation, and just lots of different things dependent on your leader and your educator will depend on when you start your cohort. So if you are hired roughly between October and January, you'll be in the spring, enrolled in the spring cohort, and you would start residency in February with a graduation date of January. If you're in the summer, you would be hired somewhere between February and May likely, and you would start your cohort in July with graduation in June. Your fall cohort begins, or I guess residents that are hired between June and September, and then your cohort would begin in October with a graduation date somewhere in September. So we have 3 cohorts going simultaneously all the time throughout the year. We see lots of residents all year long, and so it's a very busy program, keeps us busy as educators too, and we're always constantly revamping our content based on what you have expressed that worked or didn't work when you went through the session. Talk about that too. So why residency? Lots of people ask this question, why do I need to come? Like I mentioned, there is a lot of evidence that supports a nurse residency program, giving that nurse confidence, building their competence throughout that first year, and helping them to just really develop the skills necessary to be a confident and competent nurse. And so we want to do that in this program and in our sessions with you. It's a lot of information that we share with you, but it's also in a safe space where it's more controlled. You're able to ask those questions where you're not in a situation of taking care of a patient. And so it's a lot less stress where you can really sit down and absorb the information. A lot of your clinical experience over the last couple of years, just due to the pandemic, has been either shortened or non-existent. And so we really believe that the residency program for these new hires is going to really benefit you in your first year as you grow and learn as a nurse. And then also it's a socialization piece, I guess, that you can incorporate. You will meet lots of new residents just because you're in that cohort with them and attending those sessions with them. You all start roughly around the same time, so you're all going through the same experiences together as you transition through your first year as a nurse. And it's a time where you can really connect with people, maybe not inside your department, but outside of your department a little bit more. And just share your experiences and your struggles, your frustrations, because if you're feeling it, likely somebody else beside you is feeling it as well. And it's just a good opportunity to just share and vent and grow friendships. And lots of people do develop lots of really good friendships from the residency sessions. It's a mentorship. So we, as the educators, want to be there to help guide you and mentor you through your nurse residency year. So once you're off of orientation, your mentorship doesn't end. We want to continue to carry that through the residency program and into your full year as a nurse and beyond. When we are able to really connect with you and get to know what ignites you, or get to know what really gets underneath your skin, we're able to help build on that and support you through your transition into the year-long program as a nurse, and then beyond into your career. We break down lots of our sessions and include communication with multidisciplinaries, so physicians, other nurses, bedside handoff report, just tackling some of those difficult times of communication. Maybe it's communication with the patient or the family that's a struggle for you. So we really try to break that down and help guide you to through that communication phase to make it a little bit easier. Another bubble, I guess, is the clinical judgment and reasoning. Like I mentioned, residency breaks it down. It's content that we build on and build your skills on, apply it to what you're doing in practice as a nurse at the bedside, and able to build on that critical thinking. So it's really all of these things wrapped in one package, I guess, if you will, to build you as a professional nurse. Okay, so getting into the nitty gritty of residency and maybe not the not so fun pieces to talk about, but we do have to lay out the expectations so you're all aware. So we follow the corporate attendance policy in nurse residency, and you should treat your residency session like you would any other time that you're scheduled to work. So if you don't come to nurse residency, it's a no call, no show, and that would be a double occurrence, just like it would be on the unit if you just didn't show up to work. It's no different. So we, as your educators, would like to know if you're not going to be at residency, if you're going to be late to residency. We do understand things come up. It's a different time as far as getting here in the morning, so traffic might be a little bit different than when you're normally coming into your scheduled shift, and something you might not be used to if you're working the night before, which we don't necessarily recommend, but we do understand that that does happen. And you're giving report and it takes a little bit longer. Please just communicate with us that you're going to be a little bit late, you're just finishing up report, etc. Just keep those lines of communication open. Be honest with us. That's all we ask. We want to know where you're at. We want to know you're safe. If you're not at residency, we do worry. So we want to make sure that we have accountability for where you're at. And then with attendance, you must attend 75%, or that's 9 out of the 12 sessions. So graduation does count as a session. So 9 out of 12 to be able to qualify as passing in the program. It is a expectation of your job if you qualify in that less than 6 months experience or full-time, part-time. It is an expectation that you will complete the residency program. So if the case is that you don't, there could be some consequences either from your leadership or HR that might come into play and could result in termination. The attendance counts if you are there for at least 3/4 of the day. So if you need to leave 2 hours into residency, of course, let us know that, but you might end up with some makeup work to make up those 2 hours that you missed. So then I also make sure I share attendance with leadership. If you're absent from residency, leaders need to know this. So they will get an email from me to let them know that you weren't in residency with us that day. And then they will accrue it on your disciplinary action as far as attendance, their tracking record goes. So if you are going to be late, if you're going to be absent, you need to notify me and use my text or email. You need to notify your educator, so know who your floor educator is, get to know them, get to know how to get in touch with them and contact them. And then you also need to notify your director. We need to have we need to be aware that you're going to be late or tardy or gone no less than 2 hours. So 6 a.m. The day of your residency session. If you know before that, great, let us know ahead of time. So we want to support you, and we understand that sometimes things come up or your schedules don't jive with what's going on. You've got personal lives as well, but we do want to work with you. So we want you to work with your leaders. We want you to work with us, communicate so that we can get you to your scheduled residency sessions. And you don't end up with any absences if we can prevent it. That being said, if you are absent, you will receive some makeup work because it's 4 hours of content that you've missed. And so your makeup work will reflect that and what you've missed. So your educator will either email it to you, give you a folder, or assign some modules. It comes in various forms depending on what month of content you're covering. It is your responsibility. If you haven't seen makeup work, you know you were gone and you haven't received any makeup work from your educator, it is your responsibility to reach out to them and say, I need my makeup work, because it is due by that next scheduled residency session at the start of it. So please be accountable, please be professional, complete your makeup work if you are absent. That is your duty. Some service lines have modules that are assigned. So I know critical care for sure has modules almost every session prior, and they will expect before you walk in that door for residency that your modules are done. So plan ahead, plan accordingly, and get your modules completed. They do take some time to complete, but the modules are beneficial because if you get that content prior to coming to residency, you'll be able to apply it in the residency session. It all lines, the content all lines up with the content that they're going to be teaching. And so it's a kind of a prerequisite to come to that class or that residency session. So get your pre-assigned modules completed. And then if you were absent in a residency session and you were assigned makeup work and you did not complete your makeup work, that is 2 absences accrued. So already without doing your makeup work, you've accrued 2 and you can only have 3 before three absences. If you get that 4th, that is a exclusion from the program and you will not be able to graduate. All right, so excused absences include, just like the corporate policy, jury duty, bereavement, FMLA, maternity leave, military deployment, workers' comp, and then any approved PTO. So if you already have a vacation scheduled, you've already got it marked out with your leader, it's been approved, that does excuse you from residency. Now you will still receive makeup work for all of these excused absences that you're expected to complete, but they are excused. So you won't, that accrual won't go towards you as long as you do complete your makeup work. Unexcused absences include personal illness. So if you're sick, a physician's note unfortunately does not cover you for an absence. And then if you are working on your unit and you're unable to attend residency, that also counts as an absence towards residency. So keep that in mind as you're trying to switch around shifts to or help out another coworker. Make sure that you don't switch into a shift where you're scheduled to be at residency. Okay, and then the expectations in residency. So out of session, please make sure you're following corporate policies, dress code, business casual or scrubs. That's what we expect to see you wearing. No open-toed shoes, no leggings, no hoodies, sweatpants, blue jeans. Be professional. You are professional, so we want to reflect that in what you wear as well. Participation. So we expect participation, obviously, in residency. The more that you participate, the better you'll learn and absorb the information. And so sharing any stories or experiences that you've experienced or have is only going to benefit you and everybody else to kind of build on learning. And we all learn from hearing other people's experiences and then being able to apply that. So please feel free to always share. We do ask that you complete a post-evaluation after every residency session. That's just so we can evaluate how we did as educators and what was maybe not so good content, what needs to be revamped, and what you liked, what you enjoyed. So please fill those evals out after your residency sessions. We do not accept sleeping, talking. We do have lots of content experts come and speak on things that they are content experts on. And so when they present, it's really important that we give them our respect and attention because they gave us their time to share what they know and their knowledge. And so we need to respect that as well. We also ask that you are not on your cell phone. We do have some scenarios or situations where we use our cell phones in residency, and that's appropriate. However, you need to be talking and using your cell phones during assigned break times. Okay, a little bit about graduation. So graduation is a day that we celebrate you and completing the residency program because it is a long program. It's a lot of dedication. It's a lot of time committed to over a whole year. And so we want to celebrate you for completing that. And so again, you have to attend all at least 9 of the 12 sessions to be able to qualify for graduation. Your graduation date, depending on which cohort you are assigned to, is either January, June, or September. Details will be shared with you closer to the date of graduation. When you do graduate, you are awarded 36 CEs, and that is enough for your license renewal, for your first license renewal, which you have to do 2 years after you received it. And so this residency program awards you automatically all of the continuing education hours that you are required to have in the from Iowa Board of Nursing. PDL, so PDL is our professional development ladder, and it's a opportunity for you to create a portfolio based on how you are developing as a professional. And so it gives you points based on what you have done as a professional. Maybe you've been a charge nurse, maybe you've been a preceptor. Residency falls into giving you points for completion. So you're able to use those points when you submit your portfolio. It's not a requirement, but it is a benefit that Mercy offers. And once you submit it, a committee reviews your portfolio, and they will award you, if you meet all of the criteria included, with a bonus. And it's a pretty good chunk of money that's divvied out. And so that's just an additional way to get a little extra income. Once you graduate and you have no other disciplinary toward your record or your at all within your job here at Mercy, you could qualify for a merit increase. And then again, it's just a personal and professional way to help you grow as a nurse and continue on through your career. So graduation usually lasts about an hour. We shoot for having family there. With the pandemic, we've had to alter some of the requirements with allowing any visitors attend. However, if we cannot have your family or friends attend, we do offer a Zoom, and so they're able to Zoom in and see the graduation ceremony. But we do some fun things during the ceremony. We do some fun celebrations, fun shout outs, and then we will have a little ceremony where you walk across the stage and receive your 36 CE certificate. And then also a residency pin that you're able to wear. So it's a fun celebration to celebrate you. And here are a few pictures of some of the graduations. Maybe you recognize some of these residents that are listed here or posted here, but it is just really a fun celebration. And so celebrating you is important. Okay, to wrap up a little bit here, we just want to reiterate, I know a lot of this might sound a little bit harsh or rigorous, but we want to know, we want to support you. We want you to be successful. So please communicate with us and how we can help you be successful during this program. We're your advocates, we're your mentors. We want to help you. We want to educate you. We want to support you. We want you to be successful. In addition to that, we want this time that you're spending with us to be valuable, meaningful, beneficial, and applicable to your practice. We want you to come to residency and walk away feeling like you have learned so much that you're able to apply to the bedside. So that's the point of residency. And then you're able to share that with your coworkers and then beyond. But again, we value your feedback too. And we make edits based on things that you share with us, things that worked, that didn't work. So please complete those evaluations and be bold, honest, and upfront with us and give us your feedback. Okay, so we mentioned this all, but the corporate attendance policy is what we follow. Makeup work is required if you are not in attendance, and then make sure that you do sign in to receive credit for that day. There'll be a sign-in sheet that goes around, or the educator will sign you in. Just make sure that you get credit for being there that day. We have lots of residents, and so keeping track of everybody's attendance, there's not really a super easy way to do it other than just signing in to a old school pen and paper. Your participation is required and expected. Please complete the evaluations. We do ask that you check your emails at least weekly. We do a lot of communication via email. Also, your leaders do communication via email. There's process change alerts that come out via email and other memos that you wouldn't want to miss, just being an employee. So it is a professional expectation to check your emails at least weekly. Please only use your cell phones during breaks of the residency program. To graduate, we talked about you must attend at least 75% or more sessions. Graduation does count as a session, so keep that in mind. 36 CEs is enough for your license renewal, and you will be awarded that at the completion of the program. We want you to understand that we'll have your family and friends and leaders there as long as we can to celebrate you as well. We'll hopefully get to that point soon, I hope, after this pandemic. Okay, and here's my contact information again. If you have any questions, please don't hesitate to reach out. I'm on my email constantly and obviously have my phone with me as well. So text, call, or email. But if you're joining the residency program, I look forward to meeting you. And if you are watching this after you've been in the residency program or you're a leader, thank you for watching. And I appreciate all of the support through the residency program. So I'm going to stop sharing.